Sure. Thank you.
Thank you.
Okay, I think we are live now. So welcome everyone to the fourth webinar of the anniversary celebration series. Today we are happy to invite some of the former presidents in IFMSA history. We have 4 of them here with us, and Amin, the president-elect, also joined the webinar to discuss their perspectives and their comments on youth leadership in IFMSA. I will let them introduce themselves. Let's start from Kareem, the president of the term 1516.
Good day, everyone. I am Kareem Abu Zaid. I come from Egypt, and I was the president, IFMSA president for the term 2015-2016. I started working in IFMSA back in 2010 as a LORA, or Local Officer for Reproductive Health, including HIV and AIDS. Afterwards, my passion grew in the field of projects and project management, and I became IFMSA. I was elected as IFMSA Project Support Division Director, which was a position in the old structure. I served there for 2 terms, from 2011 till 2013, when I was elected as IFMSA Secretary General for 1 term until 2014, 2015, and then as IFMSA President 2015-2016. Pardon me, it has been kind of quite a long time ago. Afterwards, I worked as a clinical doctor for I think a year. I jumped between different specialties, oncology, internal medicine, oxygen therapy, and then I started my work in the field of public health, or in the field of healthcare in crisis. I served in 3 different organizations. I worked as health promotion associate for the refugees in Egypt with Caritas. I worked with the University of Berlin as mental health trainer for refugees as well. And currently I'm serving as a healthcare coordinator for a project that is a joint project between Save the Children International and the UNHCR, providing secondary healthcare services for refugees who are residing in Cairo. It's really a great opportunity to be back with you today, and it's such an honor always to have an opportunity to come back here.
Thank you, Kareem. The honor is actually ours to have like such presidents to talk with us at a very like earlier stage. Well, that sounds quite impolite, but at least to me, at the earlier stage of IFMSA in history, to see how that actually looked like back in the middle of this decade, the IFMSA. Next, we have Omar, the president of the term 1617 with us.
Hi there. So yeah, my name is Omar. From Morocco, IFMSA Morocco. So I was president in 2016, 2017, and my journey in IFMSA, I hope you can hear me well, by the way. My journey in IFMSA started back in 2012 when we created, or some friends and I founded our local committee and IFMSA Morocco, and then we joined IFMSA in 2012. And then I started working directly with the Skopje International team. I was National Exchange Officer, but I was also working with the Skopje International team as database coordinator. After that, I was in the team of officials as New Technologies Director, which is also under the old structure of IFMSA. After that, I was Skopje Director for 2 years, and then IFMSA President in 2016, 2017. After my journey in IFMSA, I worked with a medical startup in Berlin called AMBOSS, focusing on medical education around the world. I went to the US and completed a Master's of Public Health at the Johns Hopkins University. And right now I'm back in Berlin, and I'm running a nonprofit initiative with the aim to strengthen medical education in low and middle income countries, particularly in sub-Saharan Africa. So that's what I'm doing now. I'm very excited to be back here with old friends, and happy to discuss the leadership of IFMSA in the past 7 decades.
Thank you, Omar. The next is the term 1718, and unfortunately we didn't have the president to join us today. But I think if we have some questions, Batul will be also helping us, refreshing the memories back then, and also see what happens in the same term. After that, we have Batul as our president for the term 1819.
Hello, everyone. My name is Batul. I was IFMSA president in 2018-2019. And I come from Jordan. My journey with IFMSA started in 2012. I was working in my local NMO, IFMSA Jordan, at local level, a local public health officer. And I was very interested and passionate about the work that IFMSA does with all those public health campaigns and refugee campaigns and screening and awareness ones. And then I worked for IFMSA Jordan for 3 years almost, and I became IFMSA Jordan NMO president, and afterwards I joined in the term that Umar was president, and I was the liaison officer for student organizations, and afterwards I was IFMSA VPE, and till the last term, 2018-2019, I was IFMSA president. After IFMSA, I started working, after graduation, I worked with the World Health Organization. I worked in headquarters on health workforce, and I worked with the regional office on developing youth engagement strategy. And I did my master's in public health at the London School of Hygiene and Tropical Medicine. And after finishing my master's, I worked for another year as a due diligence analyst with the World Health Organization, particularly on engagements with non-state actors. I currently went back to the clinical world. I'm a junior doctor working in the UK, and I work as well as a research associate with the program of global change and global surgery and social change in Harvard Medical School. I'm very excited to talk to you today and to go over IFMSA stories throughout the past few terms, and to share experiences with fellow colleagues who I personally considered mentors and great examples in IFMSA, such as Omar and Karim, and my other colleagues which I worked with Puchen and Nibosha, and also to learn about the work of Amin as well.
Thank you, Batul. That's flattering. But next we have President Nebosha from the term 1920.
Hello, everyone. My name is Nebosha Nikovic. I come from Serbia, and I was president in the past term, as Puchin said, 1920. And before that, my journey started in 2014, when I kind of discovered the IFMSA through the exchange program they ran in my city and in the country. I then became lawyer for a couple of years and went on to kind of got more interested in the other activities of the organization, because my best friends from the organization were, you know, like local officers for public health, LRA, LRA, and so on. And I kind of went in the path of activities as Karim did, being Secretary General, which kind of handles both administrative and activities related tasks. And through that role in the national EB, I kind of also discovered the international part of IFMSA and went in the direction of Vice President for Activities in the term 1819, together with Batul. That role also has works as Secretary General for IFMSA, basically with the Secretariat, and then in the last term, 1920, as the President. Right now, I'm also looking at the clinical path of my career, with internal medicine as kind of my goal until the end of the year to kind of start the residency. Well, after that, we'll see. I didn't have much time to go through all the different things that Karim and Omar did yet.
Thank you, Nebosha. And then it's the current term. And as you can see, we didn't have a chance yet for a physical gathering of the whole TL. But some of them are actually traveling to Panama for the upcoming August meeting. So I hope we can update you with a latest photo in the upcoming days. So I'm Po Chin. I'm the current president of IFMSA. I'm from Taiwan. And before this post, I serve as two-term regional director for Asia Pacific in the term of Batur and also Nebosha. Before that, I was the task force of United Nations IFMSA, which nowadays has been reformed as a part of the External Affairs International team. And that year, during the task force of United Nations, it was also under the supervision and guidance of Batur. So that connection starts from them. At the local and national level, I was at first the local officer for Skopje, and then two-term Secretary General of my animal and then animal president. Luckily, we also held August meeting 2019 in my presidency at national level and also my first time as RD. That's kind of a good memory back then because it's happening in our hometown. I look forward to talk more with my fellow presidents, my, like Batul said, tutors, mentors, and a friend to be the president of the next year. And I give the floor to Amin.
Thank you so much, Cochin. And as you can see here, this is the ABLX. I still don't have a TO. So first of all, I want to say that I'm more than honored to be here, to be in this panel, to be in this webinar with my predecessors, the past presidents. And yeah, it's a big honor, and I thank you so much for the invitation. So yeah, my name is Amin. I am the president-elect and also the current vice president for public relations and communication. So I started as a SCORE person, doing local and national activities on human rights in my NMO, and then from there, it was in Batul's term where I started discovering PRC on an international level with Jose, who was VP PRC then. And then from then, I went to becoming public relations and communication assistant of the Scope International team, and then the VP PRC of this term, which has been an incredible journey, to say the least. I have enjoyed every moment of it, and yeah, I'm very looking forward to learning from everyone here. When I got the invitation, I was like, okay, I mean, we're gonna go. We're not going to say anything. We're just going to listen and learn. And yeah, I'm very looking forward to all the discussions that will be happening today. So thank you so much again for the invitation.
Thank you, Amin, for joining us. And I somehow believe that the future is sometimes more important than the present, because that's what we are working for and what we're aiming at. So again, official congratulations to Amin for your successful in the election, and looking forward to a more successful IFMSA that you will be leading in the upcoming month. And with that, we're going to initiate our discussion with a question directly to Amin. In the past few terms, especially mine and Nebosha's, we have experienced quite huge change, and our ambition for IFMSA has changed drastically from the history. And also with the COVID impacts, many plans and many ambitions has been changed. Nowadays, in the global international communities, we are expecting a recovery from COVID in at least some of the region, with the support of vaccine accessibility and the quarantine policies and global health policies. This question to you is: how do you envision IFMSA when you were running for the president and now preparing for the term? How does IFMSA in the post-COVID and the new normal era looks like to you?
Thank you so much for that question. I have thought about this a lot. So, like as you said, the current term has been all COVID since the beginning till its end. In the very first half, of the term, when we had like everything changed to online, we have adapted. We were able to have like all the activities online. I thought to myself like, okay, IFMSA survived. IFMSA keeps doing activities. We keep doing, like, we had an online GA. This year we had all regional meetings online. And I was like, then why do this? meetings? Why do we spend all that money, all those resources? Why do we do what we usually did in before COVID? But then the second half of the term proved me wrong, because when living, let's say, an entire term like this, I also have seen why we needed those physical meetings, for example, or why we needed to have physical activities, capacity building, you name it. Like, we have a lot of activities in IFMSA going on every day. And I think as much as everyone in here and everyone in the world is not, let's say, the biggest fan of COVID, I think COVID has taught us a lot, in a sense that it has let us explore a big range of opportunities and how to conduct online activities, how to manage IFMSA, not only to survive, but also to thrive and to grow and to sustain IFMSA in online settings. So I think the future for me maybe can be summarized in a sentence where I would say we will hopefully use what we had to learn to survive as a tool to grow and to sustain in the future. And hopefully we will merge what we knew before COVID, what we were able to acquire during COVID, and have that balance of what can be done physically and what is really necessary, and how maybe we can still expand IFMSA through our online platforms, through our online channels, etc., etc.
Thank you, Amin. That sounds like a promising future for IFMSA, at least with the experiences and what we're doing now. I believe that things can be done better, of course, and with the experiences and in the next year, of course. I think one of the most challenging thing is that many of our past activities and programs are actually conducted in person at both international and regional level. And when we are switching to a hybrid or fully virtual format, that constitute a greater challenges to IFMSA. And our international team and also the national member organizations are trying to adapt to that change and try to come up with a new format of doing those impacts in our settings. I understand that earlier there's also a gathering of past VPAs talking about the program assessments and how the impacts are being assessed. But perhaps Nabosha, also as the former VPA, how do you think that such activities in IFMSA can go in the future after COVID and with the new mindset of disease control for preventions?
Thank you, Bertrand. Well, I think one of the most important things that we realized from COVID and so on is that we have the online platforms, and now we had them for a very long time. And I remember reading annual reports from the 90s when they introduced email and how it was a huge thing for IFMSA, and from dealing with some things in the physical format and physical mail this year, I realized how much we benefit from this online connection. And I believe that the exploring online platforms allowed us to get in touch more on the ground level and provide opportunities for our members worldwide that do not have the opportunity to attend any of our meetings, to give them that valuable experience so they can conduct these activities further in their countries. So I think this is the biggest leap that we could have had from COVID, and I like to look on the good sides of a lot of these events. And I think this is the biggest benefit that we can see, that there's a lot more focus on the online aspect of learning. So we're looking at activities that were conducted online. We're not just relying on activities fair during regional meetings or GAs to share that knowledge back to our national officers or local officers, and then to different members, and then conduct those activities on the ground. But more people are looking for inspiration online than just doing those activities. But also, on the ground level, you can also see that there is the opportunity to have that online impact there as well, not just in person, going out in the world and meeting people there and discussing various important topics, but also to public health activities within the country itself, nationally. But maybe Karim also has a point, as he was also the program's coordinator, sort of.
Yeah, I couldn't agree more. on the point that was mentioned by Nibosh about having the tools, and the tools were actually there, but the shift wasn't the easiest. And if you think about it, it's actually kind of in part of the human nature to kind of resist the change, because we have ways that we agree on using and we are used to using, and we kind of find comfort in what we know already. And that shift is not easy. And I believe that definitely the whole pandemic situation has had its toll on everyone. But one of the very few positive aspects is that it kind of acted as a catalyst to the shift to the online, like online life or online work. This kind of paradigm shift wouldn't have been here today without us having to find other ways to do what we used to do on a daily basis, but using internet, using different platforms, and asking for platforms to actually get updated according to our needs. I also need to tell you that this shift has had an effect in the professional world as well, because the whole world right now has shifted towards telemedicine, and it became overnight as a norm in our life. Like right now, for example, in my job, I'm supposed to manage some clinical cases, and I reached the point that I get approvals for cases to do open heart surgeries, refer them to do the surgery, do the follow-up afterwards, and dispense all the medication that they need without ever seeing the patient, only using online secure portals to do that. And this shift has been, if we'd like to compare this shift to the shift that happened, I think around 10 years ago, when IFMSA used to have mail and email. Like I'm old enough to have witnessed that firsthand. Back in 2010, I think, a person to apply for elections in IFMSA needed to send his candidature through mail to the headquarters in Netherlands back then, and submit it through email. So that's how skeptical people were in the shift from mail to email, and that they needed to, like, some candidatures were invalidated because the mail version of the candidature didn't reach the headquarters in the AMC in Amsterdam in time before the deadline. So this is, I find in this a great shift to a tool that we will eventually, or we would have eventually been using. It only needed a catalyst, which was definitely one that had a huge toll on us. But we can actually utilize this for the future, because I believe there's a lot of countries, or a lot of countries in conflicts, a lot of countries in situations that wouldn't allow delegations to travel from those countries to other countries. And through using a combination, not per se a replacement, but a combination between the online platforms with the in-person methods of meeting or gathering or reaching consensus, this would actually help in reaching a better representation of medical students worldwide. So yeah, those are my 2 cents on this, and I think maybe I'll pass the mic to Batul to maybe elaborate more.
I think Amin and Nibosha and Karim, you've covered it really well in terms of challenges and opportunities, and I actually agree with everything that has been said. And I think that IFMSA specifically in this situation comes from a position of strength. Of course, there will be a lot of challenges, but we as an organization for the past few years, the norm for us was to reach our members through online platforms. We maintain a global organization. We maintain communication, transparency, openness, and manage our day-to-day work through online communication. So when the pandemic hit, we just focused on using those existing tools more and more. This itself will give us a lot of opportunities, because we're already prepared. We have a bigger responsibility now to reach and represent more and more people. So physical barriers, visa issues, as Kareem said, representation, those big discussions that we used to have in IFMSA, online voting, live streaming, all of these things are no longer an excuse or a hard discussion. IFMSA is already equipped to do that since we are able to carry out GAs online and have proper decision-making processes. This poses question for the future and more responsibility on the upcoming teams of when we go back to the norm of having physical meetings, how are we going to make sure the same amount of representation is still in place? We cannot lose this opportunity that we currently have. And not just only for activities, of course, activities, some of them like the capacity building opportunities that were in person, we were not able to do that. But through online capacity building events, we're able to reach more. So the question is the balance that IFMSA is going to transfer for in the future once we go back to the norm. And not to forget about as well external representation and meetings, which all transfer to being online, and the amount of people we are able to engage to speak on their behalf and to build their capacity. All of those are opportunities. The challenge is to maintain the passion and the motivation of the working teams, because we all always looked forward to meeting in person and carrying all those events and creating those memories that we don't forget, which poses a bigger responsibility on the upcoming team and on the current team as well, on how to maintain this motivation, how to maintain this functioning of the current teams without the ability to meet in person and to cover for those gaps.
Thank you, Batul. Yeah, I think it actually brought us quite huge opportunities when it comes to a more engaging decision-making process internally. But as for the external wise, at least to our observation in this past term, sometimes it's very hard for people to feel the same vibes of the external meetings and external representation when it is held virtually. And a concern is that perhaps 2 or 3 terms afterward, we might not have a generation that has attended a physical training or physical GA or even physical external meetings. And that could generate some issues if these future leaders are going to lead a physical delegation to high level places like UNGA or WHA. That kind of constitutes some challenge to them if they were not actually there, or they don't really know what's executed or implemented in a real person situation. So that follows us to our next question, which is the component of youth leadership in the global health. What kind of components or what indicators would be needed for ourselves to prepare or to be a youth leader? And that to many of our members, it sometimes means the external representation or external affairs work of a student when it comes to youth leadership in global health and also in IFMSA. So perhaps that's a good question for Batul to start with. Like, what do you see is needed when we featured or characteristic for the youth leaders?
Yeah. So I think with the current situation and how IFMSA transferred over the years, there is a growing space and a growing opportunity for people anywhere and for medical students to become youth leaders, but as well it's becoming an overwhelming space as well, with a lot of responsibility and a lot of things to do that. And I think, I apologize for the noise, and I think through the IFMSA platform, we need to utilize our collaboration with other student and youth networks to bring that voice, to make that voice stronger on international, global, and regional platforms. But the most important thing to keep in mind is what we always used to say and teach in IFMSA, which is from global to local. Everything starts at local level, and losing as we discussed in the previous discussion, losing those opportunities of meeting in person and doing those global capacity building activities. This does not mean that we lose that opportunity at local level. And I think with shifting the focus more, which is also one of IFMSA's core missions and goals, is to grow at local local level and to have a local impact on our communities. And I think there's a growing role now to have youth leaders at local level. We don't want only leaders who are able to speak in global events and to deliver policy statements, to attend meetings. We want leaders at local level who are able to engage in decision making, policy making, in influencing their communities and leading change, because that's the place that where we see change. So currently, youth leadership has a more growing opportunity at a local level, and of course at a global level, with so many topics that influence health. We saw throughout the pandemic that every single thing and every single aspect of our lives is engaged in health, and nothing can be separated. And this goes back to IFMSA mission, which is creating global leaders in health worldwide. And now public health has a growing role and a growing responsibility for all medical students to educate themselves, and for IFMSA to spread that knowledge and to spread that mission everywhere.
I actually have a question for Karim, like following the statement of Batul, because as you mentioned, well, the internet or the virtual setting of work back in 2015-16 was not as much as what we have in IFMSA in the past 2 or 3 years. So through your observations and also in your earlier times in IFMSA, what was the youth leadership look like in IFMSA? And when the international events are not so common, or when the budget or barrier to those events are higher, how and what we did to boost the youth leadership empowerment in our members and at the national and local levels?
Well, that's a great question. I would just I would like to correct one thing, but because in 2015, 2016, it was more or less, I think, kind of similar to how it is right now. But by the beginning of my time in IFMSA, which was in 2011, it was, I think, the first term that candidatures were only submitted through online platform, like the weird online internet thingy. And but by 2015, 2016, it was pretty much the normal already, and people have forgotten about how it used to be back then. But talking about the differences or the like the disparities that are existing in terms of limitations, because like after all, IFMSA is an international network, and events in IFMSA take place in different countries, from the far east to the far west, and those limitations, those has created a lot of limitations, like a lot of geographical limitations to people to partake in events, to get the chance to have some sort of like a training event or any kind of experience that kind of widen people's horizon and give them or inspire them with new ideas. And back then, it used to be a great issue. It was one of the main topics on the President Sessions agenda for every single General Assembly or regional meeting, is how to include people from different regions, from the underrepresented regions in the decision-making process in IFMSA, how to include the local members in like some countries in the low and middle income countries, to how to reinforce them, how to support them and make them like an integral cog in this whole machine. And this, it has been always a limitation. You can find how difficult it is to achieve some sort of equity in access to those opportunities. And no matter how you manage to like try to get all the opinions from people, try to create more opportunities, try to create some satellite events like SRTs or events that are away from the center. And quite frankly, but by the end of each term, we used to still have similar limitations. One of the tools that were used in order to make sure that people are represented in meetings and have access to those opportunities was the TAF, if I remember correctly. Yeah, Travel Assistance Fund. This fund was collected to allow more members from underrepresented countries to be present during IFMSA meetings. With the shift currently to the online platforms, and I believe this would apply. Like I only attended parts of the last online GA, but this would apply that a lot of people who didn't have the chance to be represented before, for their problems to be discussed at the global level, to have the chance to share their opinion in decisions that are made on the international level. Now they have an opportunity to do so. I also need to agree with what Batul has said earlier, because like the meetings that we used to do, like in-person meetings, this used to raise the motivation for people to partake and participate more in IFMSA. And this is some sort of a lesson learned from IFMSA for me, that mixing what you believe in with what you enjoy doing is the best way forward in life in general, because you're mixing your goals in life with what you're passionate about doing, and it makes it fun. So you keep on doing it, so it's self-rewarding. And part of this is actually how I personally have enjoyed expanding my own horizons and getting all my beliefs challenged at an international level, while talking with people in IFMSA, even like random talks over meals during GAs. And this is, I believe this is part of the identity of IFMSA and what makes IFMSA the exceptional, ever-existing network that it is. But right now, I think it's the right time to just blend this online tools with the already existing plans of, or already existing system of meeting for people, so that like all the limitations that some people might have in comparison to others will not be represented in the representation of medical students worldwide, and echoing the voices of everyone is just the equitable thing to do.
Thank you, Karim. In my memory, I think mental health issue has been talking about like concerning to the team of official members and international team of official in my first GA in March 2017, when Omar was the president. And also last year when the COVID was firstly hitting the world, Nebusha, as the president, I believe you have observed many changes of work and the way people work in the team of officials and IFMSA. So is there any specific capacity or feature that you observe in your experiences that are specifically needed in the members of team of officials that might help us to conduct the work of international leaders and also local leaders? Maybe we can start with Nebusha, which is more COVID-wise related.
Yeah, well, you know, when you are kind of in your room, of course, when you are in the team of officials of IFMSA, you're mostly talking to the team of officials, to the international team. You're not directly communicating with members. But one of the largest lessons that I learned a couple of months further is that such a global crisis doesn't only affect like the umbrella organization, it affects every single organization, every single member of that large organization that we have. So it wasn't something that we initially at the beginning observed. And you know, when you're making a single decision at the end, for example, regarding the General Assembly meeting that was due in August in Panama, this decision affected not only the decision-making process, it affected firstly the national board of every organization, then all the members from then on that we're hoping to attend, that we're looking forward to that experience, to the exchange, and to just see other passionate members around the world. So I think one of the largest lessons was that each global crisis affects everyone, and that we need to look at it in that sense. And also one of the things that we forget when we are out of touch, like when you're communicating like this right now, you cannot fully see the full scope of communication that we have as humans, because you only hearing me now, maybe you can see my body language a little bit, but it's completely different when you meet someone in person and when you're just communicating online. I remember that before my first EB-Elect meeting in term of 1819, I was kind of confused by some email conversations. But then when I actually met the people in person, I completely understood the rationale between everything happening there and why things were written in that way, why things were said in some way. So I think that this sort of in-person communication was kind of lost, and that affected people a lot because you could not share what you were thinking, what you were doing as easily as you could before. And also, it's not that mental health issues appeared just now because of COVID. They've been there for a very, very long time. It's just that they were not focused on so much. I mean, IFMSA, as Batul said earlier, I think, works on these online platforms for a very, very long time now. I mean, 10 years is also 15 years is a very long time as well. And still these people work at home for 300 something days per year. And there's maybe 40 days when you're meeting with others, but still you're at home and you're still a student. This is a student's organization. So you're still a student. You need to go to your classes. You need to take your exams. You need to be social, meet your friends, have some time for your family, but also for something you're passionate about. So in this case, it's IFMSA for us and and the public health sphere. And now it's become more apparent that it's very difficult for us to match this, what we are, who we are, with our aspirations. I remember listening about all the activities in Karim's term in 2016 when I attended my first GA in Malta, and hearing about the activities now. And I believe that the scope of IFMSA and the activities IFMSA conducts increased a lot. If you ask LPH, liaison officers for public health issues from the past terms that were able to attend full term and go to all the meetings, they can tell you how physically draining it also is to go to every single meeting and how you have to find the time to go to every single one of those meetings. And many people are not able to dedicate that time as well to miss exams. And we had officials that missed GAs because they had final exams which cannot be postponed. And even though we say we are going to be committed, first our role is to be a student and then to be a health advocate further on. We have to graduate and finish our studies. To conclude with this, I just want to touch back on some of the previous things because also this inability to attend everything and go forward with your passion also causes some mental health burden on people that get frustrated because of all of this. And right now with the online meetings, people that are passionate about public health and the global health in general are able to attend some meetings that they previously would not be able to for various reasons. And also even the delegations right now are increased. I only attended one meeting as representative of IFMSA, an external meeting, the World Health Summit in Berlin in 2019. But we were 4 people from IFMSA, and that's a very small amount. But also there was an opportunity for people that were there in their school in their capacity as national officers to attend. However, they were not able to because of financial issues. And right now you can just dedicate a couple of days and attend. And it's very important that these meetings are now recognized. Like before, you have to go there in person and you're attending, and then based on that experience, that addition in your CV, you can go further. And right now, if you attend an online external meeting, it still goes in your CV. It's not the same thing as Pochin said. It's not as an in-person experience, but it's a good experience to add in your CV that will help you further, and this kind of snowballs and allows you to further advance. So, I mean, there's a lot you can speak about mental health and the things that we discover now, but I would like to hear perspective from other presidents in the terms where we did not have this sort of issues as well.
Maybe Omar want to add something?
Yeah, I think. I mean, obviously, we didn't have the same issues as the one or the team of officials of this term has. But I do remember that we started talking a lot about mental health, starting from Karim's term and then in our term, and I'm sure it expanded also to Badrul's term. From our side, it was mostly the stress that the team of officials was going through, and especially with packed general assemblies, packed meetings, and so on and so forth. So what we did in our term, and I'm not quite sure if that continued after, I would assume so. But what we started in our term was to have parallel sessions in all general assemblies. Is it still the case, actually? Yeah, okay. But I think before it was really a packed agenda. We started very early in the morning. We would always obviously end the plenary super late. I remember a general assembly in India, although that's not the perfect example, but that ended at 6 a.m. and then we had 1 hour sleep and then we started again at 7 or 8 a.m. So it was just a lot of stress that we identified, and so we tried to implement some solutions or a few steps just to make it a bit better, not only for officials but also for participants. And then because it was such a big discussion, we included it into the strategy 2017-2020, and I assume that is why it has become, or that's why it was also a big topic throughout the terms after that. I assume including it in the strategy made it that we realized that was an issue and that we will act on it. But maybe Badrul can actually talk more about what was done after that and how that continued.
Yeah, so that is actually correct. It was included in the strategy that was adopted in Umar's term for the next 3 years, and there was 2 components, which is trying to check in the bylaws which decision making can be transferred from the plenaries, so we can make the plenaries shorter and we don't reach this amount of long hours, and also at the same time restructuring IFMSA GAs. And during my term, we had the initiative of restructuring IFMSA GAs, and I remember a particular discussion, one of the components, in addition to incorporating a lot of parallel events. So we focused a lot on parallels, just as in Umar's term, but in addition to include breaks, enough breaks within the GA itself, because the GA is very physically and mentally draining. And it was a huge discussion that we're going to have half a day break. And we actually did it. We had twice in both GAs half-day breaks in the middle of the GA, so we can stop losing people coming to sessions and may give the chance to people to re-energize and join. But just to add to what have been said already, I think this is an unfortunate reality that in IFMSA is very harsh on the team of officials, and we only recognize this once we become team of officials and once we leave IFMSA and start the professional work out there, and we recognize that a lot of the things that we were doing in IFMSA is not even within the normal limits of normal work, paid work in anywhere you would work outside. If you work anywhere, you can apply for leaves, for health, for health leaves, for vacation, for day leaves, and so on. And in IFMSA, we expect the team of officials to be medical students and to be working every single day and to be reached whenever and to attend all of the events and to fly physically for them and so on. I remember in the 2 terms I was in the executive board, mental health was actually indeed a big issue. And just as how we see so many people competing to become part of team of officials, I've personally seen a lot of people who were affected a lot from the team of officials in their mental health, and it was a very devastating experience for them to be a team of officials member. we did many things. One of the things also that was started in Omar's term and continued afterward, the mental health watch, in which some team of officials would support other team of officials members to try to check if there are issues at the beginning. But I think this is a message as well for Amin, because I think you have the challenge increasing more and more without having this opportunity to meet and to actually see where the gaps lie and where the pressure lies for the mental health of the team of officials. I think we need to utilize IFMSA resources more and more to support the team of officials. There should be some restructuring in which the team of officials are supported, maybe less workload. It's totally fine to expect less workload and more people working for IFMSA, maybe more paid work positions for IFMSA that can release the pressure on IFMSA team of officials, not just like one person in the secretariat. That was also part of the strategy, to have more and more people who are doing those admin and administrative tasks which are paid and relieving the pressure on the team of officials. So I think we should use IFMSA resources to do this, and there's a huge challenge and opportunity for you, Amin, for the upcoming team to support them in this and also to restructure IFMSA's current situation in this.
Thank you, Batul, and also all the reviews on the past achievement and challenges in the team of officials. I think to me, like some part of the question probably is internally in the team official itself, but moreover, I think the culture in IFMSA and how the dynamics of IFMSA team of officials, animals, and our members is a topic for us and for the future leadership in IFMSA to discover. And we are trying to incorporate that in a new strategy will be proposed. I just want to add one more thing, is that as an international organization, sometimes cultural literacy, it's a huge topic for us because we did not really have much opportunity to be trained as an international leader and lead the international and multicultural components of society before we are inaugurated as an IFMSA officials. And that sometimes could be a bit of troublesome, maybe, like people are not expecting the working mechanism or how it is working. This year, we somehow have the most diverse represented geographically members in the team of officials. It is a good indication, at least to myself, but it did arouse some of the problems because of the time zone issues and all the virtual setting work that amplify the problems behind that. But since we believe that this will be a trend, that some of the work has been going on and will further goes on at a virtual setting, I think that's a problem for the future leaders and applying TO in the upcoming August meeting to think about it. And we look forward that there will not be too demanding questions and like too challenging questions in the debate and in the presentations in the upcoming TO election, because as Batul said, sometimes it's overly demanding and that somehow strengthen the incorrect impressions among members and our team of officials, which is not a good thing. I want to also bring up another topic, which is quite exclusively work somehow by the presidents in IFMSA history, which is the alumni work. Alumni work is how we linked our current team of officials and our future with the past members as a consultations and as a consultative members in the role that is defined by our regulations and bylaws, and also by nature, we consult our predecessors for some suggestions. Now that most of the past presidents are still the alumni members and you have been actively working on this role, maybe there are some suggestions or there are some comments that you would love to give to me, Amin, or future presidents. What exactly are the alumni looking forward to receive or to interact with the current leadership? What are needed and what you would love to provide, given that most of the medical students will be medical researchers or doctors that are super busy, and sometimes some of the minor decision-making consultation might not be disturbing your busy schedules. I think that can start with Omar, since you depicted the previous strategy for us. Maybe you have some comments to make as well.
Yeah, of course. I try to work a lot or connect a lot with alumni during my term, actually, and we included it in the strategy as well. And there have been a lot of work done with alumni in general throughout our term. We even added a honorary life member at the August meeting in 2017. I do think, I mean, now being kind of on the other side, I do think that there is a lot that IFMSA can get from alumni, but also a lot that alumni can get from IFMSA that I don't think we were very much aware of. And I really, really, really believe that IFMSA is not making much use of its alumni. We have alumni in very powerful positions, in very powerful and influential organizations, yet we do not get in touch much with them. And I remember in my term, I developed a database of alumni that we would get in touch with and would invite to general assemblies. That's also, by the way, it's also mentioned in the bylaws. But I have to say, like, and I don't mean that in no way as shade for the president who came after me, but I was rarely, except I think maybe for Betul, contacted as an alumni or invited to events and so on, which makes me think that not many other alumni were also involved in IFMSA activities, which is a shame because I really do think that alumni can bring a lot to the federation. I do think that also alumni can get a lot from the federation. And it's really, I understand it a lot because on the other hand, it's also, there is a lot of work that presidents have to do. And it's really not easy to kind of do both and to kind of also work with alumni. So I do understand it, but my message to you, Pochin, but also to Amin, is to really trying to involve the alumni as much as possible, writing them emails, asking them for their opinion, especially when it comes to meetings and so on. And right now, I just got a notification on WhatsApp from one of the alumni saying, "I agree, we really need to be involved." That's an alumni. I think he is from early 2000s. So really, alumni are really just waiting for the opportunity to get involved in IFMSA, but mostly what they could get is getting involved with other alumni. I think, especially for us being kind of in early in our career, we really want to network with other alumni to perhaps just talk about IFMSA, but perhaps to also maybe further our career. And so if anything, IFMSA could benefit a lot from it, but alumni could also benefit a lot from it. So I'll stop here. Yeah, my message would just be to involve alumni as much as possible.
Yeah, we understand that, well, some of the progress are not as expected, like in the scale and in the content itself. But by the end of this term, we'll try to start disseminating the database, because for now the database requires active registration because of also GDPR, that we cannot store the information of people. So it have to be active registration in the database. We're also seeing how to expand our alumni pool from only past TO members to also including some of the outstanding IT PC members and the more president plenary team according to our bylaws, that just we don't have a procedure for such approval yet. These work will be initiated by the end of this term, and hopefully the first set of approval will be done in Amin's early part of Amin's term. We'll look how we did that. But I think I quite agree that as a soon-to-be alumni, definitely there are more things that can be done actively and passively, like not passive, like actively from the alumni and actively from IFMSA to make it a bilateral interactions among the alumni themselves. Perhaps the other president has some comments or suggestions to make. Yes, Fatou.
Yeah, I just want to add, in addition to engaging the alumni, I think it's really, really important to utilize what is already existing. And there's a lot of like current online networks for the alumni. So reach out the alumni, because I think a lot of alumni are interested to support IFMSA and growing this network and utilizing it. And we've seen throughout COVID the amount of connections that was created just because of IFMSA. And we always need to keep in mind that being an IFMSA alumni is such a prestigious prestigious thing. It has a lot of benefits, and the IFMSA can use it a lot to even like to have donations from alumni. A lot of alumni love to contribute to IFMSA, to support its external representation, to support it at local level and everything. Just talking about IFMSA strategy, because I think this is the year that IFMSA strategy is being evaluated, right, or built, I think one of them. And just not to forget as well, because during the term 2018-2019, we created the Alumni Engagement Framework, and this document was in consultation with alumni. So this document was created in consultation with the alumni of how they envision engaging with IFMSA, and it included multiple components. It was adopted by the end of our term, so we didn't actually implement it, but it's a great strategy that can guide engaging with alumni, including, like, for example, creating networks based on their interest and utilizing the existing networks and so on. So I would just suggest for Puchin and also Amin to check the document and to see, because it can guide you for upcoming steps and to utilize the power of engaging with alumni.
Thank you, Batul.
If I might add,
Yes.
just one last thing. Alumni can bring a lot to IFMSA, right? But it's not just about the money, right? There is so much more that, and I'm saying that because back in my term, a lot of people were associating alumni with getting donations from them. And I think if anything, this is maybe the least nice thing that we can get from alumni. I think there's so much more that we can get as a federation from alumni to position ourselves as global leaders. And I do think that alumni can get us there.
Okay, thank you, Omar. I think that would be the end of discussions. And now here we have some fun part. Yesterday, we collect some of your questions from members via Instagram stories, and we would love our past and the future president to answer some of them. So the first question is, I think Batul will be good to answer this one. How do you think about, like, apparently here we have only one female and 5 male presidents. What does it represent, and what impression does it leave to people and to you yourselves?
Yeah, I think gender representation and gender equity has been a huge discussion in IFMSA for so many years, and a lot of people here can reflect on this. And I remember we worked during our term on gender representation strategy, and we found we did an analysis of IFMSA events and who speaks and who participates in decision making and who is holding positions and so on. And it's very unfortunate that it takes a lot of years to have a woman as IFMSA president, and we need to have this more equity at the higher positions in the organization. And there's a lot of amazing women and working in IFMSA that can actually lead IFMSA to great places. It's actually not about not having enough equity in genders who are working in IFMSA, but actually in getting them into the leadership positions. And as we can see, like today in our webinar, there's no gender balance between having IFMSA presidents from 2015 or 16 till 2021. So we need to encourage that. We need to work on it, and we need to actually restructure our bylaws in a way that ensures that there is gender transformation and gender equity in the federation. Because we always need to keep in mind that women represent the majority of the health workforce, and we represent medical students worldwide, and we need to make sure that there's an equity in representation and work in leadership.
Yeah, I kind of agree. And thank you, Batul, for that very wonderful comments. And I hope it also encourage more of our members to apply for a different position in IFMSA leadership, and also at a different level of in our communities itself. Because sometimes IFMSA president seems to be a very obvious leader, but there are some more meaningful and more ambitious positions that can make more changes and equal changes to our daily lives. The next question, I think Amin would be good to help us answer. How do you think the information transfer can be coordinated better in this global organization?
So how do I think the information can be better coordinated in IFMSA? This is a very, very interesting question. I mean, in IFMSA, we have a lot of platforms. We have a lot of structures. We have, we like, speaking from what I have seen this year, we have like let's say two ways of sending the information. It can be either to our members, to our international teams, all the internal structures, or through our external outlets. So should it be to our audience, to our partners, and all other stakeholders? I think one of the things that I have noticed this year, and we have spoken about it also with, I mean, speaking also of alumni, we have spoken about it with Sad, and it was also one of his projects to streamline the communication that is going on both internally and externally. So there are a lot of things that we can definitely do, especially for our members, because nowadays, or at least what I've seen this term, we send a lot of emails. We send a lot of emails, and not everyone has the capacity to read all of those emails. NMO presidents, for example, can be overwhelmed from all the information that we send. Should it be a decision? Should it be a call? So there are a lot of ways that we can use. For example, we have a new website this year, a new website that can for sure be expanded and used in a better way to disseminate that information. There is also something that is in the rise, which is email marketing, that we can definitely utilize in IFMSA instead of just having those, I don't know how many words, emails to be sent to members. And external outlets wise, I think that we have a big issue in a sense that IFMSA has a lot of activities. We have a lot of standing committees. We have a lot of events going on. And sometimes when all of those events or information, sorry, shared, uh, we tend to lose each of them in all of that noise that is happening on, for example, on our social media. So I think that's also something to think about, and something that we have been discussing a lot also with the upcoming VPPRC, is how to maybe streamline more that communication, how to have a better defined framework, for example, for campaigns, instead of having, I don't know how many campaigns happening at the same time, uh, how to have a better utilization of our brand, of the voice and tone that has been adopted just in March meeting. So there's a lot that can be done for sure. And what I can say is just to keep looking at the numbers, keep looking at what IFMSA is doing, keep looking at our strengths and our weaknesses, and for sure to adapt. And I think someone said in the beginning that change can scare some people, and I 100% agree with that. If it was for me, or if I had like, I don't know how many terms, so many things we can change for IFMSA in terms of our communication or PRC, but we need to do that, and we need to adapt, and to just stay up to date with what is working for IFMSA and what needs to be improved for IFMSA.
Thank you, Amin. The next question, I believe Nebosha will be the best to answer, given his background and also his experience as a VPA and then president. So how did you actually manage the academic requirement and all the mandates that the president and IFMSA leadership should carry out?
Can you repeat the first part of the question?
Like how do you manage the academy, like school work and also IFMSA work?
Okay. Well, I have to say that a lot of people do not. I personally did not manage to do that in the way that I expected for myself. Like what I envisioned in 2012 when I enrolled and what actually happened was completely different. And I think the big piece of advice I can give for this is to set your expectations straight, as things change, and so should your expectations. Because if you expect to be perfect in everything that you're doing, that is not going to happen, and you have to decide what do you want to do. I mean, we can speak now a lot about things that were done, but then also other things. They're especially the ones that are in the executive board that actually end up having the set their expectations straightforward. Should be able to that our workload is high and that we have to, yeah.
Okay, thank you, Nebusha. I think there's some interruption with the Wi-Fi, but if people have question, you are very welcome to approach Nebusha with his email. I think he's very willing to answer more questions from your side. The next, I think it would also be good for Karim to answer because he was leading a federation when the positions are transformed and the reform was conducted. So how did you identify the most important work or your focus area when you have many interests or when the things are unclear?
Okay, that's tricky. Well, I have to say that during my time in IFMSA TO, like for 4 years, like as a TO member, I believe that at so many different points it has been unclear and it hasn't been easy to identify how IFMSA should move forward, whether in the field of projects and or programs or in the field of developing IFMSA archive or in the shift between the old leadership structure to the new one. And I believe that one important lesson that I've learned is how to actually listen and how to incorporate and ask for opinions from a lot of different people. And after all, IFMSA, like everyone who's involved in IFMSA is passionate about this federation and wants the best for it. It includes a lot of different perspectives and it includes a lot of different standpoints through which people view this federation. And I believe the priority for the federation needs to be set on the international level with proper input from all of like all of the NMOs and all of the presidents, all of the TO members, even listen to the local level and the national level. This has been quite important, for example, in the identification of how the old structure of IFMSA projects wasn't properly functioning, and to underline the need for a new system like the IFMSA programs. And this brings me to a different point, which is like data collection and data analysis. And I believe by my time in IFMSA back then, there used to be a lot of data collection in IFMSA, but there hasn't been enough effort put in the field of data analysis. Like you'd collect a lot of reports, you'd collect a lot of surveys, asking a lot of NMOs, but then the meetings of sitting down and actually analyzing what this means and how this guides us into the upcoming period of time. And I think this has been quite tricky. And yeah, I think this would lead the right way for the future. Maybe I would use this opportunity also to shed some light on the role of alumni that you have talked about before. I believe alumni, as Omar and Tatul have said earlier, are more than just willing to contribute to such way. IFMSA, it's not a secret that IFMSA has a huge turnover. Each person who's there needs to do a great job next to studying for 1 year and then you're out. Even with the strategy, one strategy could be implemented in so many different ways, but the utilization of old schools or old people, let's say, as the oldest person in this meeting here, utilizing the experiences of people from older generations and understanding how IFMSA was and how it shifted towards how it is right now. I believe this is useful for the future and how to plan for the new strategy and how to underline like the needed changes in order to fix some aspects of the federation that might not have worked before. Yeah. Also, I would just end with an incident that happened a couple of weeks ago. That I was sitting with some friends in Egypt here, and we were hanging out, some old IFMSA and IFMSA Egypt alumni, and we figured out that we could be like this table of like 6 or 7 people could set a good speakers list, for example, for one of our meetings back in the time. And it was so funny because we had people who were working on the in the field of policy making. We had people who were working in the field of advocacy. We had frontliners who are working directly with people in need. We have clinicians. We have lecturers who like know the theory by heart, and I believe every one of those people back then would have ran at an opportunity to be able to benefit IFMSA or kind of pay back IFMSA for all the great memories, great experiences, and skills that we have developed back there. So I think, yeah, a lot of alumni members would love to contribute to IFMSA, and I think there's a lot to explore back there. And just commenting on one of the comments that you have said, Puchin, that in terms of like what happened in accordance to expectations, I actually believe that alumni shouldn't be an additional source of pressure to the EB and the TO. I believe the right role for alumni to be the supportive kind of grannies who help reassuring somehow the TO that, yeah, we have been through similar situations. Yeah, it's not the end of the world. Yes, there's a problem. Yes, you're gonna handle it. Even asking for an advice, asking for an opinion, even consulting for something like strategy development, or like having such a meeting that we're having today. Yeah, I think those would be great opportunities to include alumni in. And yeah, last thing, I would like to thank you for inviting us for this, because I totally I totally appreciate to have such an opportunity to come back and meet a lot of different generations in IFMSA. It's such a pleasure and honor to me. Thank you.
Thank you, Karim. The next question is for Omar. And since we talk about about the mental health a lot, there are some members curious about what's the status of mental health of the past presidents, and if we have any specific approach to resolve that. If Omar can give us some recommendations and personal experiences on this.
Do you mean during our term or currently?
Like during the term, or maybe currently, that also.
During our term.
Yeah.
I mean, during the term, I assume is more relevant. During IFMSA, I think there are a lot of factors that play into the mental health of every person. And during my term specifically, I think I probably had the least challenges compared to other presidents, mostly because, I mean, obviously I had an amazing TO and just like everyone else, but I think most importantly, I had an amazing executive board, which was always supportive and helpful, and they knew what they needed to do. They would do it, and that really contributed a lot to an efficient work, but also contributed a lot to our own mental health. And I think having that support and being surrounded by officials and by a team and by friends actually who were supportive, who were helpful, and who could jump right back into whatever we needed to do, I think that was the best that we could ever ask for. So if anything, and if I have to give a recommendation to Amin, that would be to surround himself with officials that could really help him throughout his term, to gain their trust as well, and to just make sure to have a cohesive team as much as possible.
Thank you, Omar. And before we end this webinar, I personally am aware that there are many people excited to see Batul joining us today in the webinar. So I'm going to serve her fans by giving her one more question. And perhaps people are more interested about your personal feelings. So this question is, what are the 3 achievement or lessons you learned from your IFMSA journeys? And what are your personal thoughts about, like, reflection on this whole experiences?
Okay, so I think from the things that I've learned in IFMSA is, first of all, the importance of teamwork. And I've seen this when I was IFMSA VPE, and we had 2 resignations within the executive board, and we couldn't get replacements for the resignations, and how the important teamwork would actually affect the mental health of the people working in the executive board, and how it can actually reflect on the team of officials. And I had a great experience when I was IFMSA president with working with a team that actually taught me the importance of teamwork and sharing and distributing the work and making sure that the workload is reasonable for everyone and having goals. And the second lesson is, I think, the importance of strategically thinking about things in IFMSA and not just doing things ad hoc. And I think I've seen this because I've witnessed in Omar's term how the strategy that was built, and in my 2 terms in the EB and IFMSA president, we built the global priorities and incorporated them into IFMSA work, and both of those things were a strategic approach to IFMSA global impact on an internal and external level, and those things really helped us to measure our impact, to see what we can do, where can we reach, and what we have done throughout the term, and to plan the work and make sure that that everyone has a proper workload and is working on certain things. And a third lesson would be the importance of networking, and this is just complementing everything that has been said. IFMSA alumni is everywhere. A lot of them has great places out there, and how much IFMSA can benefit from networking. And it's actually a skill that you would really need in the world out there. Once you finish IFMSA, one of the best things that can help you in your career and in your progress is networking and mentorship, and getting mentors from people who shared your experiences. What was the second part of the question, or have I answered?
Yeah, I think you mostly covered, but it was about the reflection of the journey in IFMSA.
Yeah, I do believe it's one of the most amazing journeys that anyone can have, but at the same time we need to keep in mind that it can be an overwhelming journey at the same time, and the friendships and the memories you make in IFMSA is something that you can. I'm not sure, it's been like 3 years, but there's nothing that can mimic what I have lived or seen in IFMSA, or actually learned from IFMSA for professional and for future career. So enjoy every moment and use every opportunity and benefit from learning from others in IFMSA and networking with them.
Thank you, Batul. I hope these question and the answer serves the needs of the fans and they will know you more by person. Before we finish this webinar, I'm going to keep the last question to myself, and I think I can answer it properly. This question is from our current regional director for Europe, Mariona, and her question is, why is Amin the most amazing human beings? Well, from my personal observation, we have a very wonderful president-elect, and I'm going to confirm to you that although with 1 more GA and 3 more months to go, in the upcoming term, Amin will show great leadership and lead the team officials and IFMSA to the best and to a better level. So thank you again all for joining this webinar, the speakers and whoever are in front of the laptop, cell phone watching this webinar. I hope that it empowers more mentally and give you more encouragement to stand up, voice up for the majority and the people around you, and that you are ready to take on more responsibility, being a leadership in your community and get the empowerment in IFMSA, because sometimes being a leader is not just something you pursue, it's also an obligation when you are the most suitable person and when the timing is the correct for you to shoulder that responsibility. So all the best to Amin. Congratulations again for your new team to come. And as I believe, as all the former presidents and my friends, mentors has mentioned, alumni will be there to support, and we look forward to having more dynamically interactions among teams and we wish everyone safe and healthy, especially during this very pandemic period. Thank you again for joining, and that's the end of our webinar.